Hey Marcella.
Hi, Dr. Matta. Great to see you as well.
You're just in time. We're about to do a little mini consultation on Craig and Nadia, who are both interested in Restylane, which you may know is a hyaluronic acid skin filler. It's used to augment cheeks, fill in lips, improve smile lines, lift up the chin, you name it. We can completely facially sculpt an individual and it looks wonderful. Okay, so I'm going to give Craig the mirror and I'm going to show him the different things we can do. And a male face obviously is going to be different than a female face. Okay. So men don't like it when the front of their cheek drops down. It starts to make them look tired and sallow and you get this jowling going on. So what we do is we treat this area here to try and bring that back up. The other thing is this outer aspect here. On a woman it's very different. You try and sculpt a nice high cheekbone which looks really sexy. But in a man you don't want to make him look particularly sexy that way.
Right.
So that's what we're going to do with Craig. And then we have Nadia, who thankfully is a lot prettier. And we don't have a lot to do because she looks so great already. But what we're going to do is fill in a little bit into the cheek here because again, as we mature, some of that cheek drops. And you can see a little bit of hollowness here. So not much compared to another woman in her age bracket because she's aging absolutely beautifully. And as well, this area here, which is the smile line. And a little bit into this chin area, a little bit down in here. And those are the different things we're going to do to try and make her look fresh and useful. Okay, Nadia, you all set?
Already.
Okay, so we're going to do a little bit of Restylane Perlane in that cheek. And we're going to move a little bit down into this fold and a little bit into the chin just to soften things up a bit. And I'm just going to start right now. The ice pack will help take away a little bit of the discomfort of the needle prick, but there is anesthetic in the material, so you won't feel any pain once it's being injected. This will last on average about 6 to 12 months. The more we put in, the longer it will last, and it builds on itself. It's completely safe. It's hyaluronic acid, so it's the same thing that's in your own skin, which holds water. So it holds about 3,000 times its weight in water, and that adds a very nice lifting effect to the skin as well as hydration of the skin in general. What we're going to do is we're injecting the front part of your cheek. You feel a little bit of a pinprick, which is better with the ice than it is without. And then the anesthetic is in the material, so it doesn't really hurt once we've started the process. You may have a tiny little bruising, a little bit of swelling. That's always possible, but it's not particularly common. Okay, Nadia, so we're just cleaning up that last little bit here. And how do you like it?
I love it.
Okay, so what we did, we filled in a little bit in the cheek up here. We increased the sexiness of the bone up here, so it's giving you a nice high cheekbone. We filled in this area, the smile line. We also did a little bit in this superficial line here. And this is one of my favorite areas to treat, which is the chin area. And again, as we age, the chin starts to drop. So by putting a little bit in here, it just makes it look a little more useful. You will have a tiny little bruise there. I apologize, and a tiny little bruise there, which can happen, but it will be very minimally noticeable. And you can just use some arnica to help settle that down. And you basically just go home today with your ice packs and it'll settle in the next couple of weeks. You're going to see how it's fully settled in, and I'm sure you'll be pleased with everything.
I love it.
Okay, now it's this young man's turn. So, Craig, what we did is we filled in a significant amount in the front of your cheek here. You do have some old acne scars which limited our ability to completely eliminate that, but we did improve it significantly. We've lifted up this whole area that was hollow before. You can see the little poke marks here. So this is now more uniform as opposed to sunken in. We didn't really need to treat in this area because I think it looks relatively rugged on men. We don't want to completely get rid of it. This is an area that we may need to do a little bit more down the road. So it's one of those things that we like to see how it settles in. So we don't always do the full treatment right at one time. We'll do it, we'll see how it settles, give it 3-4 weeks, a month or two, and then if you want, you can always touch it up. You can always add a little bit more. So I suspect that we will add a little bit more on this side because I'm still seeing a little bit of jowling going on here compared to this side. But again, we had a little bit of a weaker bone up here, so we're going to maybe build up a little bit more up there and help that lift up. So how do you like it?
Yeah, I think it looks great.
Okay, not a problem, bruising, pain, or any of that?
No, it's all fine. Everything's good.
So we'll see you guys in a few weeks, see how it all settles, and if you have any questions, just give us a shout. So that's a full treatment of...
Perfect. It looks fabulous, you guys. So thanks for tuning in. I'm Marcella Barrick, and we're live with Revive, and we'll see you next time.